I'm Dr. Craig Lammer from the Mayo Clinic in Rochester, Minnesota. I'm here at DDW 2013 presenting my data regarding coffee drinking in primary biliary cirrhosis and primary sclerosing cholangitis. These two diseases are well known but rare cholestatic liver diseases that are thought to be autoimmune. However, environmental factors and genetic factors are probably the big risk factors for pathogenesis, but we don't understand these quite well. Ultimately, over the past couple of years, we know that coffee has been related to all-cause and specific mortality reduction per the New England Journal article of last year. With this as well, there's been important hepatology outcomes seen in the literature over the past 20 years, specifically seeing a decreased risk in liver enzyme elevations in patients that are high risk for elevations. Also a decreased risk in fibrosis progression, specifically in NAFLD, hepatitis C, and also alcoholic hepatitis. Therefore, these findings triggered our group to invest some time and effort to evaluate the question of coffee in these cholestatic disorders, PBC and PSC. The data was interesting, and specifically we found that patients with PSC tended to be more never coffee drinkers over their lifetime versus our control population. This effect was not seen within primary biliary cirrhosis. Ultimately, we don't know exactly what this means, but it does highlight a possible modifiable risk factor that may help mitigate the risk of PSC specifically. It does highlight another important aspect of how these diseases are quite different. This mirrors possibly the understanding of smoking being a risk factor for PBC and protective in PSC as well. Nonetheless, further dissection of this finding will likely help us understand the underlying pathogenesis of these disorders to some more degree. Ultimately, I don't know if it's ready for prime time for recommending coffee and drinking to everyone or every liver patient, but nonetheless, these findings are quite intriguing, specifically that coffee can be found on just about every block these days. We presented this research at DDW 2013 in Orlando, Florida.